Our second session explores a rapidly growing area of interest in medicine, the gut brain food connection. Our next speaker is Dr. Noble Varghese Mathews, Assistant Professor, Department of Medical Gastroenterology, CMC Vellore. Dr. Noble holds national and international recognitions with specialization in therapeutic endoscopy, GI motility disorders, and neurogastroenterology. A passionate teacher and researcher, his work spans areas like corrosive GI injuries, neuroendocrine tumors, and biofeedback therapy. He will be speaking on the topic diet and gut health, the key connection, an exploration of how nutrition influences gut health, metabolism, and mental well being. Dr. Noble, the stage is yours.
Good afternoon, one and all. It was a really cellular level talk by Sir that really fueled. I think all of you are, I don't know how interesting my topic is going to be. However, I won't be going into a cellular level. It will be more of a, what do you call it? When I got the call from FNB regarding my topic, I was a bit confused on what exactly is expected of me. So somehow I've tried to put up a few of the clinical scenarios that we come across and how would a gastroenterologist fit into this theme of food safety. So I'll be basically dwelling on certain key aspects of diet and the gut. I'll be emphasizing on a few diseases. Nowadays, we see that every disease can be connected to the food. But naturally, the scope of my talk won't go in that direction. I've probably cherry-picked a few topics, few clinical situations or conditions or diagnosis that have quite a lot of evidence to say that diet is related to that particular condition. So without further ado, I'll start off. So the question that most people or patients that when they come to the OPD ask is, the question of what to eat is the most commonly asked, and it is the most difficult answer to also give to your patient or whoever asks you, what do I eat? So sometimes it's kind of easy for us to tell you don't eat so and so. So then the next question is, what do I eat? It's very difficult. So because the type of food that's available to you is enormous. It's so many varieties, and it's branded in different ways. It has a lot of food additives, that this, even if it's fresh vegetables, again, the way it's made and all, there are a lot of things that go into it. So it's very difficult as a clinician to tell somebody these are the types of food you can eat. There are certain diseases, for example, coronary artery disease or maybe diabetes. These conditions you can probably tell, okay, you go like this. But as far as gut diseases are concerned, though we have a lot of evidence or literature that's coming up, at least now it's coming up in a much bigger way. But otherwise, there is no telltale or die-hard evidence to give you saying that, you should eat only this or you should eat only that. There are no, the level of evidence is not that great. We only have quite a few observational studies which say that, you eat so and so food, you can prevent this. But again, for a person diagnosed with a particular condition, you can be more specific. But for generally, when a normal person comes and asks you whether, what kind of food, it's a very difficult situation. Maybe as nutritionists, most of your dietitians sitting here, most of you will know what's a well-balanced diet. So we all know this much amount of fiber, carbohydrate, protein, fats. So that is what you generally tell. But here I'll be discussing a little different from that, in the sense there is something that a gastroenterologist cannot let go of. That is something that lies between your food and you. That means between the food and the gut, there is a living thing that's sitting there. So that has a major role, and that's the importance of that is coming up in a bigger way. Can anyone tell me what I'm talking about? Yeah, so it's the gut microbiome. Good. So gut microbiome, it's an enigma. Nobody knows very well about the gut microbiome. Everybody has their own postulates. However, with the available evidence, I can tell you how it works in the and how you can modulate this gut microbiome in a way that's favorable to your health. So my discussion will be basically on three topics: the influence of diet on the gut microbiome, its effect on gastrointestinal disorders, and gastrointestinal malignancies. I won't be going into too much of detail. It's just one or two slides on each of them. And just to give you a brief overview of what diet and gut has to do. So the human gut microbiome. So what is microbiome? It is basically a community of microorganisms where fungi, bacteria, viruses, protozoans, all of them coexist in a mutually helpful manner. That's what you call a community. So they exist along the intestinal epithelium in such a way that they provide beneficial effects to the body. So that's when they are called as probiotics. You would have heard of probiotics. So when the microbiome provides beneficial effect, they are called as probiotics. So uh, as I told you, it's an intricate and dynamic ecosystem, and it has a significant role in the health and disease of the person. So if you have a favorable gut microbiota, you are assumed to be in a favorable gut health. But if you have an unfavorable microbiota, you are assumed to be, or you are predisposed to developing a disease. So this is something that where science is still evolving. Nobody has and can. I mean, the difficulty comes in the part where typing the gut microbiomes and trying to find out which particular gut microbiome will be good. So that's very difficult. That is a very difficult area, and that's still evolving. However, in an otherwise healthy individual, you would consider that his microbiome is good, but his microbiome may not be identical to another healthy person. Then what do we know? We know that there are certain microorganisms that are more in a healthy person, and there are certain microorganisms that are less in a healthy person. So that means certain are abundant in one person, certain are less abundant in another person. So that is one thing that we can know. Second thing, the diversity. There is a lot of different types of microbiome in a healthy person. Probably in an unhealthy or a diseased person, there are less diversity, meaning you don't have too much of diverse type of microbiome. So a healthy microbiome is generally considered abundant and diverse. And then there are multiple characteristics like they are resilient, meaning they are not easily affected by a diet. For example, you take an antibiotic. A healthy microbiome generally tends to resist that effect by the antibiotic, and they can easily come back. They can easily regrow. But when you have an unhealthy microbiome, that might just go off, and it's difficult for them to come back. So you take a course of antibiotics, and then your gut goes for a toss. Then you develop bloating, acidity, all kinds of flatulence, pain, and then it becomes a miserable time. And then you need to give it time for the good microbiomes to come back. And in that space of time, if you resort to eating unhealthy, for example, that I'll come to that later. If you resort to eating unhealthy, you are actually sowing the seeds for a microbiome that is unhealthy to grow in abundance. And if you keep eating that same unhealthy diet again and again, then those microbiomes that thrive on this unhealthy food will flourish in your intestines. And that leads to future chronic inflammatory disorders and all the other diseases. So this is the basic thing behind human gut microbiome. So as I told you, it's a complex interplay: diet, gut microbiome, and the immune system. So the critical regulatory mechanisms for preserving homeostasis are present, and they defend against external pathogens. So if you have a good microbiome, not just antibiotics, in case some kind of a germ or an pathogen enters your digestive system, which is quite common, it's easy for a pathogen to enter your body. your microbiome, if you have a diverse, abundant, healthy microbiome, it can resist that. It will not allow that pathogen to flourish in your gut. But of course, there are certain pathogens, despite having a healthy microbiome, can easily flourish. For example, cholera is one, typhoid is one. So these kind of pathogens are known that if you are exposed, even minute quantities can lead to a disease manifestation. But otherwise, your microbiome can easily overcome and maybe prevent the increase or the prevent these particular pathogenic organisms to multiply within your gut. So this is just similar to what I just told. Diets can have considerable beneficial or negative influences on the composition and functionality of the gut microbiome. The Mediterranean diet. How many of you have heard of the Mediterranean diet? So it's quite common. I think most of you have heard of it. So Mediterranean diet is considered to positively influence the gut microbiota and human health. However, that said, the same diet consumed by two different people can result in differing metabolic health effects and a personalized microbial response. So that doesn't mean you have a disease, you go and take my Mediterranean diet, you're going to be fine. No, that is not the meaning. However, studies have shown that having a Mediterranean diet has significant beneficial effects for your gut microbiome and in turn in your health outcomes. I'll be detailing regarding that. So, what is a Mediterranean diet? It's a diet that emphasizes on a high intake of unprocessed whole plant foods, olive oil, dairy products, moderate consumption of poultry and fish. So it's not like non-veg is all bad. Non-veg is good when the right things are taken in the right amounts and low amounts of red meat. So red meat should be kept to the minimum, fish to a higher amount, some amount of poultry, unprocessed food, olive oil, and plant-based or vegetarian food. So this is what is being told to be a Mediterranean diet. So does that mean all people who take a Mediterranean diet are protected? No, because the gut microbiota is influenced not only by the diet, it is influenced by multiple things. Multiple things affect your gut microbiome. It can be even that day what you're thinking, mean even the hormones that go through your body, in the sense you're stressed out on a day, or you're going through a lot of stress. Even a psychological stress can alter your gut microbiome. So there are multiple things that act upon your gut microbiome, and it's not the diet is just one of them. Or as the topic is food safety, I'll be dwelling more on the diet. And Mediterranean diet has emerged as a gold standard in preventive medicine and health promotion. So if you just see, this is just a table. It's quite crowded. So I was just trying to put out the type of diets that you would see. Generally, that's described in literature and what people take. The Mediterranean diet, the high fiber diet, plant-based diet, high protein diet, ketogenic diet, Western diet. So at one look, now everyone will feel that, yeah, look, there are more plants in one side, then one is more of processed food. So that is likely to be less healthy. In a way, it's true. That is likely to be less healthy. So that's proven also. So the increased consumption of sweetened foods, very high calorie, low nutritive carbohydrates, and fats and greasy food, all these have a negative effect on your microbiome. Meaning the bacteria that thrive on this food going into your intestine do not have beneficial health effects. It's as simple as that. However, the bacteria that increase, I'm not going into the names of the bacteria, it's kind of big. Any microbiology people here will be more interested in it. So the bacteria that thrive on Mediterranean diet have favorable health benefits. That is basically what I was trying to put out through this slide. So I did not mention about the Indian diet. So is there something called the Indian diet? So in literature, you may not find too much of this word because Indian diet is very heterogeneous. However, there is something that has been defined as the Indian thali diet. So that's usually it is what we talk about is a veg thali. So what is an Indian thali diet? Is it good? Is it good enough for a person, or does it have beneficial health effects? Apparently, yes. So it provides fiber, different phytochemicals. Phytochemicals are the components where you see in colored foods. For example, the color of foods like beetroot, or if you mango, all the yellow, the colored foods have high amounts of phytochemicals, and they help restore diversity in the gut bacteria and may potentially prevent or even reverse chronic diseases. So you can see that all these foods, for example, um, whatever goes into the Indian diet, the turmeric, the masala, the chili powder, cumin, dals, drumsticks. Drumsticks apparently are becoming more and more favorable, saying that drumsticks are very beneficial in every way to the gut microbiome and in general. Then vegetables, um, banana flour, carrot, beans, then all your components of sambar, rasam, and all have lot of phytochemicals and fiber, and that is very favorable to developing a healthy gut microbiome. And I don't may not have to tell more about curd, which is definitely a rich source of probiotics, and which definitely helps in restoring a normal gut microbiome and a good health. So now coming on to something that is a what I would say is a nightmare for many patients. At the same time, which we clinicians tend to, ignore or maybe not look into much. It's irritable bowel syndrome. So it is a health disease that we gastroenterologists see day in and day out. But if you ask me whether there is a permanent cure for this, we still don't have an answer. There is no particular magic drug for irritable bowel syndrome, and that is and the reason for that is it's got a multifactorial pathogenesis. There is a lot of, that there are a lot of stakeholders in IBS, and at the same time, gut microbiota is a very sensitive area where the research or science have not reached that level where we can say we we put your gut with so much of bacteria of so proportions and your IBS will get better. We have not reached that stage yet. However, diet has an important role. As you can see, sleep, psychological stress, visceral hypersensitivity, some amount of bile acid malabsorption, gut motility, all these, your serotonin transmissions, everything can affect and cause symptoms of IBS. So a small message maybe in from this session would be that diet definitely has a pathophysiology in IBS. It causes hypersensitivity, food intolerance, shift in microbiota, alteration in mucosal permeability. So what dietary advice can we give to a person who has IBS? So as you know, IBS, there are mainly three types: diarrhea predominant, constipation predominant. Some people get pain and diarrhea. Not all pain and diarrhea at IBS, definitely without red flag signs that we call blood in stools. Otherwise, a normal person having a long standing history of abdominal dysfunction and some alteration in bowel habits. So if they have diarrhea predominant IBS, there we usually tell them to take a high, we ask them to take a low FODMAP diet and to avoid a high FODMAP diet. So they should not take a high FODMAP diet. So what is a high FODMAP diet? They ferment in the gut and cause gas, bloating, and altered bowel habits. For example, now the examples that I've given here: onions, garlics, bean, lentils, wheat, rye, all these are actually healthy foods. So that does not mean these foods are unhealthy, but these foods are unhealthy or cause significant discomfort to a person who has IBS. So a person who has IBS with a predominant diarrhea should keep these foods to the minimum. And so generally what I do in my OPD is if I tell them don't take beans, don't take garlic, don't take onion, don't take this, then they will go on a spree of not taking anything. 2 months later, they'll come back. They were like probably 60, now they are 50. And they are like, I'm not eating anything now. And they keep on, losing weight, or, some other, they develop some other cause due to malnutrition. So these are just from observational studies that people have come across this. Not everybody will need to avoid all this. However, if you tend to have these kind of symptoms, you can come down on your high FODMAP foods and resort to a low FODMAP diet. Second thing, in IBS, constipation predominant. Try to take a higher fiber content in your meals. So whenever your dietary fiber plays an important role. So as you know, there are soluble fibers, insoluble fibers. So insoluble fibers can worsen bloating and discomfort in some individuals, especially with IBS. However, soluble fibers like oats, psyllium are often better tolerated. And one another, which is very commonly used as far as clinicians are concerned, is something that we have, the ispagula husk and all are generally soluble fibers that are much more tolerated for people with IBS, and they generally have a better, the patient and a normal person tolerates that better when they develop constipation and lesser bloating. So again, high fat intake, as I told you earlier, it slows gastric emptying, may stimulate gut hypersensitivity, contractions, worsening IBS. Caffeine, coffee can worsen IBS. So again, people who have these kind of symptoms can, of course, come down on their caffeine intake. Again, caffeine is not only in coffee, caffeine is there in a lot of food, which we generally don't realize. Even in soft drinks, all of them, most of them are caffeinated. Most of the soft drinks. Then alcohol, which irritates the gut lining, disrupts the microbiome, and spicy foods can stimulate visceral sensitivity in the gut. Carbonated beverages can cause some people, they tend to, you know, people with bloating and all that, they feel that they take a carbonated drink and they can burp out a lot of gas, and that will help with their IBS symptoms. Actually, it in fact worsens it. So they may feel some kind of relief with the air that's stuck in their stomach, exactly in the stomach, to go off. But what causes your symptoms is predominantly the bloating that happens in your intestines. And by taking in carbohydrates, you're pushing in more of gas, or you're bloating up the small intestine further, which actually works the other way around. So carbonated beverages actually should be avoided for a person with a lot of bloating. And food additives, which is extremely common in the food additives, and I would also say emulsifiers are very common. Any food packet you take, there will be emulsifiers. That is basically, in the current day and age, for their to keep that food on the shelf, or that to market that food and to prolong the shelf life, most of the time emulsifiers, or even to enhance the texture of your food. So emulsifiers have become a must. So without emulsifiers, you can't go and pick a thing from your grocery store. So it's part and parcel. And all these, though there are no scientific evidence, it's emerging, but the big people hold emulsifiers. So if you can't get any research showing that emulsifiers are bad for your gut health. However, there are observational studies that say that emulsifiers are not good. But imagine if someone comes out telling so and so emulsifiers are causing health hazard, there will be a lot of big nutritional companies or big food companies that will have to shut down tomorrow. So I would say that there is not enough funding to do such kind of research to prove that these are actually harmful. Probably it's something that we have to live with. And food allergies or intolerances, lactose intolerance, fructose malabsorption, gluten sensitivity, not going to details of it, can mimic or exacerbate IBS. The other disease that I would like to, just one slide on it, inflammatory bowel disease. Now, this is unlike IBS. This is something that is, again, diet is coming to have a more significant role in inflammatory bowel disease. This is a condition where there is a dysregulation of immune responses, where your body's immune response is becoming extremely aggressive, and it starts attacking your own intestine, which, and in a genetically susceptible individual, it can cause symptoms of disease. So the disease expression is triggered by additional environmental factors also. However, this is also a disease that is currently emerging, and probably by sticking on to a healthy diet, by sticking on to probably something like a, as I told you, a vegetarian based or a Mediterranean based diet, maybe we may see lesser IBD, because IBD was not a disease that was known in the past. And now, due to the westernization of the Indian food, now we tend to, it's wherever you see there are fast food shops. Everyone loves fast foods. So all these can manipulate your intestine into IBD was generally considered a disease of the West. It was not that much seen in the Indian or the Asian population. But now we are adopting Western cultures, and that type of disease have now become a part and parcel of the Indian society also. So the Western diet adoption, and there are maltodextrins and emulsifiers. They may have a role in development of IBD. So this maltodextrins and all are, if you see canned foods or foods that are preserved, or processed foods, for example, even your your sandwich, your burgers, your hot dogs, all these are processed, and these are processed foods that contain high levels of emulsifiers, maltodextrins and all that can predispose you to developing IBD. So a healthy food is better to stick on to more of fresh food, fresh produce, and less of processed food. And it's important to know that vitamin D may have a protective role protect you from developing IBD. And for some reason, whether it's our skin color or for whatever reason, there are multiple studies that say that vitamin D is low in Indian population. If you see, if if you just check the vitamin D levels of maybe staff in CMC itself, you'll realize most of us will end up becoming deficient unless and until we have taken some supplements. The reason is not very clear. However, most of people are low in vitamin D, and it would be a good thing that we have our vitamin D replenished and get a normal level, because there is more and more emerging evidence that vitamin D, probably the insufficient levels of vitamin D play an important role in immune mediated disorders, not only IBD, but other inflammatory disorders, for example, on the skin, psoriasis, or even diabetes, in developing all these disorders in an otherwise healthy individual. So next topic, colorectal cancer. Just one slide on this. India ranks 5th in colorectal cancer mortality with 38,000 odd deaths in 2022. So again, colorectal cancer is another gut disorder that is linked to diet. So we have kind of evidence coming through, and quite significant evidence to suggest that the increased consumption of red meat, processed food, or high fatty food, alcohol, all these predispose to developing colorectal cancer. However, fruits and vegetables, fish, increased physical activity, and certain medicines like metformin and all, that's coming up. But our topic will be more into look into diet, the fresh produce, milk and dairy. All these have a protective effect on the colon, and the change in lifestyle and dietary practices, all these can help prevent the development of colorectal cancer. So there is emerging evidence of this, though it's difficult to conduct RCTs on this. However, there are good observational studies that point on to diet and development of colorectal cancer. So predisposing factors, red meat, alcohol, and that there is convincing evidence. Suggestive is processed meat. Protective factors, as I told you earlier, dietary fiber, dietary calcium. Dietary calcium is also a good protective factor considered against development of colorectal cancer, and increased consumption of probiotics, yogurts, curds, and so on. Diet and gastric cancer. Again, the evidence is not as strong as for colorectal cancer. Gastric cancer, there is emerging evidence that taking a lot of salt preserved food is one of the reasons for developing gastric cancer. Now, the part of the world that takes the highest amount of salt preserved food is generally Japan and those areas. So there is a thing. Just now, sir told that the Okinawa community that's got a long lifespan, don't they take salt preserved foods? So there are other factors also that play there. So in Japan, since there is a very high incidence of gastric cancer, their surveillance protocols in place by their government to prevent an advanced gastric cancer are extremely high, meaning they have they have a genetic predisposition also. It's not just the salt. This is just an observational evidence. They have very frequent, in fact, their endoscopies are quite advanced, and their screening protocols are much more advanced in the sense but in India, we have not reached that stage where we should recommend everybody to undergo an endoscopy if they have a dyspeptic symptom. No, that's not practical, and that's not advised either, because our prevalence of gastric cancer is much, much, much lesser than what we see in the East and probably the Far East, like Japan. So they tend to screen individuals without symptoms from a very young age, which is government sponsored, and they keep doing endoscopies and doing which even we have narrowband imaging and high definition imaging, and screen the stomach to see for any early signs of gastric cancer and remove it at the bud. But recommendation of that in our country right now, definitely it's not needed. If we do that, it will be unnecessary utilization of what resources we have. Probably maintaining a healthy diet would be more important, and rather stick on to the alarms, meaning something like weight loss, or maybe if your age is above 55 and you are developing new onset symptoms, if you have blood in stools, you have a drop in hemoglobin, you have a loss of appetite, or if you have a strong family history of cancer, these are the ones probably that we should keep on a close follow up. And recommending surveillance, as the Japanese do, may not be our way to go. Because I specifically stressed on this fact because many people who come to our OPD, when they have some kind of abdominal discomfort, they're very anxious. Do I have cancer? They want an endoscopy. Without an endoscopy, they will not leave your room. So the easiest thing for us is to write an endoscopy and go. So this was just that, endoscopy may not be the answer right now, as far as we are concerned, and probably a healthy lifestyle would be more important. Probably heavy alcohol consumption and salt preserved food are currently considered. So eating of pickles, apparently appalam, the pappadam is one of the most high salt foods that has been told, and probably we have to come down on all these high salt foods in our diet, which can also help us with our dietary safe gut health. So I think summarizing today's session, gut microbiome is a dynamic ecosystem which is influenced by diet, playing a critical role in health and disease. Dietary impact, as I told you, Mediterranean diet promotes microbial diversity and gut health. Western diet rich in processed foods correlates with inflammation and disease risk. IBS triggered by high FODMAPs, fat, caffeine, alcohol, spicy food additives. Individualized dietary management is key, and that individualized dietary management is generally the patient decides what diet I can take. We can tell you that these are the foods that are triggers, so you decide to come down on something. Don't rely on a doctor telling cut down on this, because the doctor or the person sees you at one point in time. They may not know what kind of food that you usually take. So you are the boss at that time to decide whether when I take some particular foods, I get triggers. That means there is something that's different in your microbiome that's different from others. And one size fits all may not be applicable here. Inflammatory bowel disease, diets with emulsifiers, maltodextrins, and low vitamin D may worsen IBD. Colorectal cancer, red meat and alcohol increase risk. Fiber, yogurt, calcium offer protection. Gastric cancer, risk increased by high salt and heavy alcohol intake. I conclude by saying that what we eat shapes how we digest, defend, and develop. Thank you.
Thank you, Dr. Noble, for that fascinating and deep informative session where you had imparted us with a good knowledge on the gastrointestinal diseases and had laid an emphasis on gut microbiome and favorable to health, and on the direct association of diet, immune system, and gut microbiome. You helped us understand on how what we eat affects not only our digestion, but our brain immunity and for our long-term health. The floor is now open for the questions from the audience and from our online participants. Any questions?
What is your opinion on probiotics? Please ask.
So, probiotics, definitely my opinion would be that for a person, what we see usually, now what we see how patients respond to probiotics. I wouldn't say that everyone needs to take probiotics as a capsule or a tablet. It may not be that everyone has to take it. However, because probiotic generally, one of the rich sources of probiotics is curd. So if you're a person who has curd, or if you are a person who tends to eat some kind of fermented food, I'm not talking about alcohol here. Otherwise, so they generally get their probiotics from their diet. You may not need to supplement it. However, if you have functional bowel diseases, for example, your tests are all normal, you see a doctor, all your tests, but you get this bloating, gas kind of symptoms. Generally, probiotics give a significant relief in symptoms. So probiotics definitely help, and taking a probiotic maybe for a short duration, can be for a week or maybe for 2 weeks, definitely helps. If you have an altered gut microbiota, theoretically you put in some good bacteria and keep putting that for some time, give it time, and you prevent from taking fatty foods at the same time. So you're reducing the bad bacteria, flourishing your gut with the good bacteria, definitely makes sense. And probiotics are coming up in a big way in many diseases, probiotic consumption. So for a for a normal person, maybe you may not jump into taking a probiotic. You can just maintain a healthy diet. In a diet which is high in fiber, your probiotics will come on its own. However, if you feel you have some kind of symptoms, some kind of GI disturbances disturbing you, you can always take a probiotics to get back on track.
So there's one more question through the online. It's been asked, is there any other diagnosis to avoid endoscopy?
I think what the person is asking is there any other test that you can do that can replace an endoscopy? Probably that is what they are asking. So, see, endoscopy at maybe it might not be. I mean, the person who has asked it might not be very happy with my answer. But at present, we don't have a replacement for endoscopy as of now. You have to do an endoscopy because it is kind of a little, it kind of freaks out people. It's not a very comfortable thing for someone to shove a scope up your throat down into your stomach and look. So it's a little difficult test as far as the patients are concerned. We keep doing it day in and day out, so we kind of underestimate, but when we do it on ourselves we realize. So um, as of now we don't have a replacement for endoscopy. There are other tests like a camera on a capsule, but that cannot be considered as a replacement for endoscopy, because taking a capsule to see your gut is something, is a totally different reason altogether. And the cost, it's definitely not cost effective. An endoscopy may cost you around 2 to 3,000 rupees, but a capsule endoscopy will cost you closely to around 65,000 to 75,000 rupees. So definitely capsule endoscopy is not a replacement for your normal gastroscopy, and not everyone requires an endoscopy. Endoscopy is only for those whom, before you decide that you need an endoscopy, probably you need to see a gastroenterologist or a physician and decide whether you have alarms which can predispose that you require an endoscopy. And not everyone, most of us, 90, maybe more than 90% of us who think that we need an endoscopy ultimately may not require, but we end up doing in as the most common reason that we end up doing in a person that really does not require an endoscopy is the anxiety that the person has, that whether I have a disease, you do a scopy, look normal, I'm happy, you're happy. So that is the reason why ultimately most end up getting an endoscopy. Answer to that, we don't have a replacement for a gastroscopy as of now.
Any more questions?
Thank you.
Thank you once again, sir. As we draw today's session to a close, we extend our deepest gratitude to both our inspiring speakers, our dedicated organizing team, and each participant who joined us for today. Let's carry these insights into our homes, our communities, and even our cafeterias, remembering, say no to junk food, yes to healthy choices. Because when we eat right, we live right. Let's keep learning, keep growing, and keep transforming together.